So next we're going to do some muscle length assessments. We're going to start with the Thomas test, which assesses the hip flexors, including specifically the iliopsoas and the rectus femoris. This camera angle is going to be a little awkward, so I apologize in advance. So the way this test is going to start, ideally in a clinical scenario, you would have a table that can raise and lower to the height of your choice. In our situation, we have a massage table that costs not a lot of money, so it cannot do those things. So in our case, what I'm going to have her do is I'm going to have her squat so that way her hips are on the end of the table, kind of with your butt like even a little bit farther off. There you go, just wiggle a little bit. All right, so from here, just going to squat so that I'm in the camera. From here, I'm going to have her grab one leg, wrap around, and then she is going to lay back. Nice and easy. So I have a hand under her lumbar spine to ensure that her back is flat to the table. And then we're going to assess her leg and where her knee is positioned. So I can tell that her back is flat, her knee is where it should be. But from here, we can see that her thigh is past midline, so her iliopsoas is actually okay. Where the problem arises is with the rectus femoris. So as you can see, her knee is not flexed to 90, so this is indicating rectus femoris tightness. We can do some stretches here. You can also assess this on the other side, so I would have her sit back up again. And then we're going to do the same thing, readjust, grab that other leg, and then we're going to go back again, have my hand under her again, and you'll notice the difference. So the rectus femoris is not nearly as tight on this side, so we got a little bit more of a bend in the knee, and her iliopsoas is still okay because midline is here, so parallel to the floor. So that's Thomas' test. From here, I'm going to have you sit back on the table. I'm going to adjust the camera. Beautiful. Apologize for the noise there. So for the hamstrings, there's a couple different tests you can use to assess hamstring flexibility. There's the 90-90 test, but in many clinical scenarios, we'll just do this test instead. So what I'm going to have you do is try to sit up straight. So in long sitting, ideally, you want to make sure that the knees aren't flexed and that she can maintain a normal lordosis. Can you sit up straighter? Is that comfortable or does that feel tight? It's tight. It's a little tight. So although she's not compensating in her knees, she is compensating in her back. You can't tell as much on the camera, but basically she's doing the posterior pelvic tilt and kind of curving her back. So that way, with that pelvic rotation, she's kind of putting her hamstrings on slack with that posterior pelvic tilt. So ideally, you want to see a little bit of that average lordosis that you would see when they're in short sitting. So she's a little positive, but not nearly as positive as I am if you go and watch Katie's video of me. So from here, now that we've assessed hamstring length, we're going to move on to gastroc and soleus. So if you want to lean back and get yourself comfy. From here, we have gastroc and we have soleus. One of them goes over the knee and the other does not. So we're going to be putting our patient into dorsiflexion, and ideally they should have at least 10 degrees. We're a little tight here, but we have a little something. And then we're going to bend the knee and see if we can get that dorsiflexion even further, which we do. So that first one is assessing gastroc, and then by taking the knee into flexion, you're getting the soleus. To get an idea of how tight those are, you can also assess bilaterally with the knee in extension, and then again with the knee in flexion. So from here, we have piriformis test. So I'm going to have you do a full 180 turn for camera purposes. And that should work just fine. We'll be here. How's that? Beautiful. So for this test, your piriformis, you're going to flex their hip passively, and then you can relax their knee, and you're going to basically be taking their knee and taking it towards their opposite shoulder. So you're creating flexion, adduction, and then you can use your forearm on their tibia to get a little bit of internal rotation as well. So you're assessing that end feel and seeing just how far you can get them. And then you can also assess on the other side to compare. As far as a positive test, you're just kind of going based on which side is tighter. So you can use that forearm to help you get that internal rotation or flexing and adducting. So you're aiming towards that shoulder. She's actually pretty good. So from here, then we have over test. So if you want to turn on that side towards the camera, if you want to wiggle back towards me, beautiful. So you want to make sure that they're in neutral, they're not like leaning forward or leaning back. And then from here, there's the modified over and the over test. One is focusing with, one gets the IT min involved, and the other is just kind of half the TFL. So you're going to have that knee in flexion, supporting with your hand under the knee, and you can use your forearm to support the rest of their leg. I'll also use my hip to kind of take some of the weight, just because it's easier, especially if you have a larger patient. So you have the other hand on the hip, assessing when that pelvis moves or stabilizing based on your strategy to the test. But you're going to go into hip flexion, abduction to go around and take the IT band out, and then you're holding onto that hip and slowly dropping the leg down. And when you start to feel that pelvis move, that's when you would stop the test. So as you can see in the camera, she is about at parallel to the table. So she's just barely making it with this test. If she was to stop up here in abduction, that would definitely be a positive test. And if she can make it farther down, if the hip wouldn't have moved, which it did, if she could make it here without the hip moving, then it would be a negative test indicating that she's all right and she's not tight or shortened musculature. So you can also do this on the other side as well, if she were to flip and do the other side, but for camera purposes, we'll just show you this side today. Next, we'll be assessing strength using the myotomes of the lower extremity. So we're going to start with L2, which is hip flexion. So for hip flexion, I'm going to bring her knee up a little bit, and I'm going to have her resist into my hand. If that's too difficult, we can do it in gravity minimize. So just bring your knee up, following my hand. Beautiful. Next, I'm going to wrap my arm underneath her leg, and I'm going to use my other hand to push into her ankle. So push into me, take your leg out. Awesome. If that's too difficult, gravity minimize. Have them externally rotate and bring that knee out. So from there, we have L4, dorsiflexion. So come into my hand. Beautiful. That's too hard. Externally rotate and do the same thing. Toes to the sky. From here, we got big toe for L5, so push into me. Beautiful. Gravity minimize, out to the side. Beautiful. Then from here, get them into neutral, and we're going to do plantar flexion for S1. Awesome. Yet again, external rotation to get gravity minimized. And last, but certainly not least, we're going to bend the knee again in supine. Hold on to the knee so that she doesn't go anywhere, and then she's going to bring that knee back for knee flexion for S2. Gravity minimized, out to the side, and bend that knee. And you assess this bilaterally. Next, we're going to be assessing abdominal strength and core stability. Two of the most important muscles to consider when assessing abdominal strength and core stability is the multifidus and the transversus abdominis, getting your stability from the front and from the back. So first of all, we want to look at transverse abdominis activation. Typically, when you think of your abs, you think of your rectus abdominis, you think of your obliques, but the deeper muscles are what's really contributing to your core stability and your balance, and it's one of the most underused muscles, so therefore why we need to work on it. So this can also be a treatment as well, but in this case, we're going to use it as an assessment to just see if she can get the activation in the first place. So, I have my patient in hook lying. So what I'm going to do is I'm going to raise your shirt up. Hopefully you can see okay. And in order to palpate the transverse abdominis, you want to fall immediately off of the ASIS and instruct your patient to draw in their belly button towards the table. And with that, you can actually have them palpate on the other side. So you can just take your left hand and feel right about the same places where I'm at. And then try to draw in your belly button towards your spine without sucking in your gut like you're putting on a corset. Like it's just contracting that muscle. Beautiful, and you'll feel it pop into your hand. There you go. And if they can't get it, another trick is to have them cough or laugh, and they can feel that, and then try to recreate that muscle activation without the cough or the laugh. So once they can get this, then you want to try to have them hold it and see if the muscular endurance of the transversus abdominis. So hold that contraction, and then try to lift this leg up just a bit, and then bring it back down, and then try the other side. And see how long they can maintain the contraction, see the quality of the contraction, if it, dies down as they're moving, things like that. So the next activity that we're going to try is having our patient in prone. So if you want to flip over, this is going to focus on the multifidus. So if you think about your traditional bird dog in quadruped where they're extending one arm and one leg, we're basically going to recreate this in a smaller fashion with them in prone as an assessment technique to see if the multifidus is activating. So in this way, what I'm going to have my patient do is we're going to start with the lower extremities because it's easier. So I'm going to have my patient, actually I'm going to come over to this side. I'm going to have my patient extend her left leg, and that's going to be firing her right multifidi. So I'm going to be palpating for those contractions. See if she can hold it for a couple seconds, see if the muscles are weaker, or see if you can feel them activating, and then back down. And then you can try on the other side as well. To see if the quality of the contractions are the same, see if lower segments are weaker than higher segments, and so forth. Thank you, Katie. So that's one of the many ways that you can assess abdominal strength and core stability. Next, we're going to do a general neurological assessment using this little tool right here. It's got a dull end and it's got the pinpoint end, so you get dull and sharp. It comes out of a reflex hammer that comes in our lab kits. So we're going to follow the myotones from the Olson text, and we're going to use the dull and sharp to get a general assessment of sensation. So the patient will just respond yes based on whether they feel it or not. You want to try to go in a random pattern from dull to sharp, and also mix in some false positives. So asking if they feel something but not actually touching them, so that way they're not catching onto a pattern. And that we're getting a genuine assessment of their sensation. So first you would test it on their hands, so that way they know this is sharp, this is dull. So you can feel that, right? Mm-hmm. All right. So what I'm going to have you do is close your eyes, and then we're just going to work our way down. Let me know yes or no when you feel it. Yes. Yes. That's a 1. Out 2, we're going to work our way down. Yes. How about now? No. How about now? Yes. Beautiful. How about now? Yes. Awesome. No. Okay. Okay. Awesome. Work a little bit farther down. Start to cross the knee. Yes. Beautiful. Yes. No. No. Yes. Awesome. Yes. Farther down to L4. Yes. Awesome. Yes. How now? No. How far do we start to get closer to the foot? Yep. Awesome. Now. Awesome. Yep. Begin to S1 closer to the heel. Yep. S1 is medial on the back of the leg, and then S2, or S2 is medial on the back of the leg. S1 is lateral. Yep. Awesome. You'd also assess this bilaterally. Next, we're going to do some deep tendon reflexes. So we're going to screen the upper extremities. So I'm going to get her biceps here, putting your thumb on the biceps tendon, and then you're striking on your thumb. And you're going for supination, just like that. Then Bring the arm out. I gotta switch hands here. And then you're going for the triceps tendon for the triceps. Make sure the camera can see that one. And you're looking for a little bit of elbow extension like that. Then, moving to the lower extremities, I'll adjust the camera down. That'll do. We're gonna go for patellar. Same thing, patellar tendon. Beautiful, just like that. And then for Achilles, you're going to get the foot into neutral, and then you're going on the Achilles tendon for a little bit of plantar flexion. So these reflexes are graded on a scale of 0 to 4. 2 is considered normal. Under 2 is considered hyporeflexive, and above 2 is considered hyperreflexive on like a graded scale. Next, we'll be doing some further neural tension tests with the passive straight leg raise. So exactly as the name suggests, we're going to be doing a passive straight leg raise. So you'll start with the traditional straight leg raise with the leg in neutral. And you're just going to use the ankle to bring them up nice and slow and ask for any complaints of pain. And if so, you want to get a general idea as to what kind of pain they're having, whether it's muscular tightness or if they feel like shooting down their leg. I noticed that once we got up into that higher register, I could feel the hamstrings constricting and kind of getting tight. So, with that being said, if the patient presents with pain in between 0 and 70, typically that's indicative of some form of neural tension. And if it's between 70 and above, then that's typically more of a hamstring tightness or tightness in the other posterior chain muscles, or it could be indicative of SI joint dysfunction due to the torque and tension that's created on the SI joint once you get into that higher range, creating that tilt on the pelvis. As that femur is articulating within the acetabulum. Sorry, losing my voice. So, from there, there are different variations of this test. So, say they were to present with some pain here, you could back off and then have them raise their head. There you go, now you can see it in the camera, and see if that provokes symptoms. That could be a neural tension, or you can just extend their big toe, and that would be specific to L5, as that's the dermatome that goes with it, or myotome that goes with it. And you could also do inversion or eversion of the foot. So if you invert, you're putting the tibialis, the fibularis nerve on tension, or peroneal nerve. Or if you evert, you're putting the tibialis nerve on tension. So it could be specifically trying to address where that neural tension is coming from. And that's that. So next, we're going to assess the thoracic spine and the ribs. So you have your patient in prone, ideally with their head in a little bit of a caveat, so that way their neck's not all torsioned, which can have an impact on the thoracic spine as well. So we're going to start with extension, which is your traditional posterior anterior force on the spinous process. I personally like to start low and work my way up. So you're applying the force through your pisiform and just assessing mobility, doing grades 1 through 4 on those spinous processes, working your way up, creating an extension moment on the thoracic spine. Then from there, you're going to go on to the transverse processes using your index and middle finger. So find that spinous process and then come off. And then you're going to use your other hand to create the actual force, so that way the hand underneath can relax. And then you're going to do the same thing, work your way up, and assess mobility and willingness to move. So this is a reflection of a thoracic spine. You want your forearm on top to be in the direction of the force, And that lower hand, you don't want it to be up here, you want it to be able to relax so that way you can actually feel what's happening in the thoracic spine. From here, we're going to assess for rotation. So there's two different ways you can do rotation. You can either just use one transverse process and go to one-sided, so you can use the other hand to feel and one to press, do a posterior force and assess for rotation at one level. Or you can use the rule of the lower finger and use that transverse process trick like you used before, but tilt it so that one is above. So you can palpate, find that transverse process and the one above using that hand just like you did before. And the rule of the lower finger says that you're creating a rotation based on what's happening above, and that rotation is going to be based on the lower finger. So in this case, my finger on the right side is lower, so we're going to be creating a right rotation. And you can do this working your way up the thoracic spine. You can also switch and bring that other finger lower and assess rotation to the other side. From here, you can also assess the ribs, so coming off of the transverse process, using that kind of karate chop hand positioning, and assess the ribs. I personally think it's a lot easier to start low and work your way up, just because the ribs are a lot easier to feel when the scapulas aren't in your way. So I use that other hand on top to provide that force. So my force is going into the table and a little bit lateral. Right off of the transverse process, assessing for mobility. And my hand is following the curvature of the rib. So my pinky finger is kind of like aligning alongside it. And as you get farther up, when the scapulas start to get in your way, you want to make sure that their arms are out to the side, so that way the scapula is as far out of your way as possible. You'll be using more of the side of your hand versus like taking the force through your entire hand. There. You can also go around to do it on the other side, or you can just angle your body differently, so that way you can get that assessment as well. You could also just switch hands and do it on that side that way. Some people find this way to be a little bit uncomfortable just because you're creating a lot of radial deviation, but it all depends on how you angle your body and best address your body mechanics. So next we're going to screen for diastasis recti. It's a pretty common condition involving the linea alba and the abdominal muscles. It's pretty common to occur during pregnancy, typically found postpartum. So the way it's going to work is we're going to palpate the umbilicus, and then we're going to have her do a crunch by bringing her head and shoulders off the table. Beautiful. And then back down. So you're looking for a gapping that's like 2 finger widths or more, which is cause for concern. So then you're going to go 4.5 centimeters above and repeat. So you're going to crunch one more time and back down. So a gapping or a soft spot would be cause for concern, but ideally the abs are going to contract and it's going to kind of pop and like push your finger away. So we're going to go below for the last time. We're going to do one more time, up and then down. And that's how you screen for diastasis.